Well, hello, Joanne. Fancy seeing you here.
Hi Joe, good to see you again. I hope you've been well.
Thank you, Joanne. Yeah, and I hope you've been well and keeping safe. And can I just say, absolute pleasure to see you again and to be recording another one of our little videos. Now, Joanne, what are we going to be talking about today?
So Joe, I thought we'd focus on a specific hair condition today, one that affects millions of women in the UK and on a global capacity. I'm talking about androgenetic alopecia, or AGA, which is more commonly known as female pattern hair loss.
Okay. Well, I'm going to start this off very simple, Joanne. What exactly is female pattern hair loss?
Well, one thing I want to stress before I start is that AGA does affect both women and men, but I solely want to focus on how it's affecting women today. You see, you've got to understand that that it's the leading cause for hair loss in women in the UK and in the world, but there is still a lot of misunderstanding on this subject. And the hairs on the crown of the scalp and along the parting will both shed quicker and grow slower, leading to an overall thinning of the hair and a more visible scalp.
So you're saying that it is the loss along here and along the parting, and is that why it's called a pattern hair loss? Is it because it just gradually goes along this kind of route?
Yes, that's correct.
Okay, makes sense.
So by the age of 40% of women will be affected, and the risk of developing the condition only increases with age, with an estimated 50% of women showing signs of hair loss by the age of 65.
So I'm going to be honest with you, Joanne. I've not heard much about hair loss in women. I mean, in even more specifically this condition. So I'm both interested and almost happy that we are going to be talking about this today because I'm imagining there's a lot of people who, just like myself, do not know about this. So I guess my next question would be, how and why does female pattern hair loss express itself?
So it's all down to hormone imbalance called androgens, and these hormones regulate a lot of activity in your body, including the hair growth. And women suffering from pattern hair loss will have an overexpression of androgens, which affects the cycle of hair growth, and it disrupts it completely, causing the thinning effect. As to why, there are a few reasons. One uncontrollable one is genetics, and if it runs in the family, there's a higher chance you'll develop it. And also, specific events in life may also trigger it, such as pregnancy and menopause. Both are associated with a big hormonal change and imbalance. And certain autoimmune diseases or conditions may provoke hair loss, as well as medication. Also, any traumatic or stressful episodes, diet. There are many causes to female pattern hair loss.
Okay. It does sound like there's many reasons why you could develop the condition, and that does make it sound like it'd be hard to diagnose it. So what can be expected for someone who would undergo a diagnosis of the condition?
So a blood test for one.
Hmm.
This will help rule out certain diseases or isolate any vitamins lacking from your diet. Most likely any history of hair loss in the family or any big events, good or bad, will also be discussed. But the main focus will be on the hair loss itself. And it's important to find out when it actually started, and what areas are affected and how quickly it's progressed.
Okay, that makes sense. So that's more from a practitioner point of view. From a patient's point of view, would you recommend any telltale signs, any symptoms almost that people can be looking out for, certain signs that might indicate that you might be suffering from this condition?
That's a really good point, Joe. And if you notice more hair on your pillow or in the shower, or
Okay.
more hairs in your comb or brush, you know, I definitely advise to seek advice. Don't wait for the thinning. to be noticeable, as this would mean it's already reached a late stage.
Okay. Now, I do have a question for you as a woman. Would you say you know or have seen this a lot? Do you reckon there's a lot of people in your life who's suffering from this condition?
Yeah, well, as I mentioned earlier on, over 40% of women will be affected by the age of 40. So, there's a high risk that women will start to see changes when they hit that magical age of 40.
Okay. And do you reckon that maybe raising awareness like we're doing right now could hopefully help with the early diagnosis of a condition?
Absolutely.
It's good. Well, let's hope. Well, listen, thank you very much for your candor, very much for your time, Joanne, and I look forward to our second interview.
Thank you, Joe. Always a pleasure.